Everyone, it's Laura Jordan with Jordan Therapy Services, coming to you today with another video in a series that I've been doing between videos and blog posts and Facebook posts regarding pregnancy and infant loss. October is Pregnancy and Infant Loss Awareness Month, and so I thought it would be important and hopefully a beneficial series for some of you out there that have struggled with that or are currently struggling with this very different and what I've been kind of referring to as a special kind of loss. And what I mean by that is that it's very different from your traditional loss where you may be grieving and may have lost a loved one who had a longer life. And so there's some things that make this sort of grieving a pregnancy loss or an infant loss very different from a traditional loss. And so I wanted to talk a little bit about those differences today, just to assure everyone out there that may be struggling with this that, you know, what you're feeling, what you're experiencing is very normal. And part of healing, an important part of healing, is feeling like you're not alone. And so I wanted to put this out there in order to hopefully accomplish that goal of helping those who are struggling with this feel not so alone. So first big difference that comes to mind for me is the secrecy around a pregnancy or an infant loss. That's especially true for sort of an earlier a loss experienced earlier in pregnancy. There's just a ton of secrecy around that, and I think I've brought that up in nearly every other blog post or video that I've put out there this month in honor of this month being geared towards pregnancy loss and infant loss. And it bears repeating, and because it does just complicate and add to the difficulty of processing this kind of loss. It's just not as open. It can go unknown that this loss was perhaps experienced. Next up, a big difference is that a funeral or memorial service is just not a given in this situation. Again, it's just not as open. People may be feeling, having a funeral or memorial service may make it real. The woman and her partner may not feel ready to sort of face that reality, and something like a memorial service may make it feel that much more real. Or that fear of judgment and society not really being able to handle that, people around us not really being able to handle that kind of loss. And so, next up is the heavy shame and blame that come along with these kinds of losses, sort of pointing fingers at mom, and kind of insinuating that something could have been done differently, which is usually not the case. And so you just don't see that usually in a more traditional kind of loss. If someone passes, of natural causes, you don't have people usually pointing the finger and saying, oh, well, it was this person's fault. And it's just a big difference, and one that just adds another layer to the difficulty of processing, grieving, and moving through this kind of loss. And kind of last but not least, another thing that comes to mind, and this kind of loss comes with a lot of differences surrounding it. And so these are just a few that kind of came to mind as maybe some important ones to acknowledge. So the last one is that a loss like this can have the potential of going unacknowledged by other people. A loss of this kind, a pregnancy or an infant loss, is more than most people can bear to even think about. Unfortunately, we go through this kind of loss as, the woman who is carrying and the partner. But the people around us, it's, some people just choose to not acknowledge it, unfortunately. And we kind of touched on this in a previous video, and it's unfortunate, and it's really sad and unfair. And again, just adds another layer of difficulty in sort of surviving this kind of loss and this kind of grief. It's a huge sort of mountain of grief to overcome. And to add on top of it is just not really spoken about. And so, it's being spoken about a little bit more, I think, in the media and with celebrities talking about losses that they may have had. So I have hope that the stigma around it will sort of dissipate with time, but for now it's still very present and makes it just that much more difficult to move through and to process and to grieve in a healthy way. So I hope today has been helpful. If you have any questions, any concerns, if you would like to find out more about me and my practice, you can do that at JordanTherapyServices.com. Thanks so much for watching, and have a wonderful day.